Good afternoon, everyone, and welcome to the North Dakota Department of Health briefing on COVID-19 vaccines. My name is Molly Howell, and I'm the Director of Immunization at the North Dakota Department of Health. I'm sure most of you have seen national media today, but out of an abundance of caution, the North Dakota Department of Health is urging healthcare providers to pause in their administration of the Johnson & Johnson COVID-19 vaccine until the Centers for Disease Control and Prevention and the FDA issue further guidance on the use of this vaccine. As of April 12th, 2021, which is yesterday, more than 6.8 million doses of Johnson & Johnson vaccine have been administered in the United States. CDC and FDA are reviewing data involving 6 reported cases of rare and severe type of blood clot in individuals after receiving the J&J vaccine. In these cases, a type of blood clot called cerebral venous sinus thrombosis, CVST, was seen in combination with low levels of blood platelets. All 6 of the cases that have been reported in the United States are among women ages 18 to 48, and symptoms occurred 6 to 13 days after vaccination with the Johnson & Johnson COVID-19 vaccine. 1 case has been fatal, and 1 individual is still hospitalized in critical condition. No cases of CVST after the Johnson & Johnson COVID-19 vaccination have been reported in North Dakota. For North Dakotans who have received the Johnson & Johnson COVID-19 vaccine within the last 3 weeks, we want you to know the warning signs of CVST. They include headache, abdominal pain, leg pain, and/or shortness of breath. If you experience any of these symptoms, we're encouraging you to contact your healthcare provider and seek medical attention immediately. Also, please note that it's normal to have some mild side effects after vaccination, including mild fever or headache or fatigue, joint pain, but those usually happen right after vaccination and only last a couple of days. This pause in administration of the COVID-19 vaccine from Johnson & Johnson shows that our vaccine safety monitoring system in the United States is transparent and working. Vaccine safety data is being assessed and collected in real time, and our robust safety monitoring systems can detect and evaluate even very rare safety signals for after vaccination. Individuals who want to be vaccinated for COVID-19 vaccine should now receive Pfizer or Moderna vaccine. Over 180 million doses of the Pfizer and Moderna COVID-19 vaccines have been administered in the U.S. The only safety concern that's been identified is the rare anaphylaxis, an allergic reaction that we've talked about previously. And anaphylaxis is manageable, and treatment is available for that. No other concerning safety signals have been associated with either the Pfizer or Moderna vaccine. One thing to note is the vast majority of physicians who have been offered COVID-19 vaccines have accepted vaccination, and so you should feel comfortable that if doctors are accepting the vaccine, that you should too. And if you have questions about COVID-19 vaccine, we urge the public to contact their healthcare provider. More and more North Dakotans are choosing to be vaccinated against COVID-19. According to CDC's data tracker, 47.8% of North Dakotans ages 18 and older have received at least 1 dose. The U.S. Census Household Pulse Survey is reporting that 73% of North Dakotans surveyed either will definitely or probably get vaccinated against COVID-19. Nationally, we're still in a pandemic. According to the CDC, the 7-day moving average of new cases is 67,500 cases per day, which is up from less than 54,000 cases a month ago. And the 7-day average of new deaths is now over 700 deaths a day in the United States. And that's up from more than 70 deaths a day in early April. North Dakota is still in a pretty good position. Our 14-day positivity rate remains under 5% and has leveled off this past week. And we continue to be a leader in vaccine administration, getting doses into arms as soon as they're received in the state. However, we do need to still remain vigilant. Today, we have more than 1,100 active cases and a net increase of 44 cases just today. Variants continue to spread throughout the United States and in North Dakota. And hospitalizations in North Dakota, while low, are higher than what they were a month ago. COVID-19 is a severe disease which leads to hospitalization and death. 1 in 200 North Dakotans have been hospitalized for COVID-19. Think about how many Facebook friends you have. That's one of your Facebook friends or more, if you have more than 200 friends, that's been hospitalized for COVID-19. Even those with mild to moderate illness can have long-term side effects from COVID, including shortness of breath, fatigue, and memory loss. Take control over your health and choose to be vaccinated. Vaccination appears to prevent asymptomatic infection and likely transmission to others. So you're not only vaccinating for yourself, but to prevent COVID-19 in people that you love. And vaccination against COVID-19 continues to be safer than risking the disease. That's what I had to share today, and I'd be happy to open it up for any questions that you might have. Yep.
So how many doses of Johnson & Johnson do we have throughout the state right now, and what are we going to do with them in this period?
As of yesterday, 21,224 Johnson & Johnson doses have been administered in North Dakota, and that's out of 25,500 doses received. We have informed providers through a health alert, and we had a webinar with them earlier today to pause an administration of the Johnson & Johnson vaccine, but to keep that vaccine in the refrigerator, mark it as do not use, in case after investigation it's determined that the vaccine should continue to be used. Yeah.
In regards to replacing those, I know a lot of pharmacies have received the Johnson & Johnson. That was the first recommendation you guys had. Is that who you guys are primarily looking at to replace the Johnson & Johnson with Pfizer and Moderna?
We do have Moderna and Pfizer available, and our allocation did increase for this week, so we will be able to replace Johnson & Johnson doses that providers were supposed to be receiving or already have received but can't be used. I do know some of our universities had Johnson & Johnson clinics scheduled for this week, and those doses have been replaced with other vaccines. And so we are working closely with providers to replace the doses, and providers are canceling their clinics that they had scheduled for the J&J vaccine. Yep.
From looking at the dashboard, it looks like the Janssen vaccine has so far been a relatively small part of North Dakota's vaccine rollout. Wondering if you can talk a little bit about why it's played a smaller role, and if you expect that this pause will cause any sort of interruption to the pace of vaccine rollout in North Dakota.
Yeah, so this week we were anticipating receiving 1,400 doses of the Johnson & Johnson vaccine. That's in comparison to over 11,000 Pfizer doses and over 7,000 Moderna doses. And so it is a smaller proportion of the doses that we're receiving in the state. Looking back through the data, Johnson & Johnson represents 5% of all doses that we've received in North Dakota of COVID-19 vaccine. And so it has played a smaller role in vaccination, one being it was available later. It didn't become available or wasn't authorized until February 27th, where the other vaccines have been authorized since December and January. Also, Johnson & Johnson have had some manufacturing issues that have made some doses not available, and they haven't really smoothed out, I guess, as the federal government would say, their manufacturing and availability, where we weren't really receiving a dedicated amount. It's really been fluctuating each week as to how much Johnson & Johnson vaccine we're receiving. So because it was only 1,400 doses and we've received increases in our Moderna and Pfizer, we don't anticipate it having that much of an impact in terms of availability in North Dakota. And so the public who wants to be vaccinated for COVID-19 should seek out vaccine and should be able to access vaccine. Yep.
You talked about keeping the Johnson & Johnson vaccines in the fridge until this investigation is up. Do you have more information on what would need to be found in the investigation in order to bring the vaccine back in a safe way?
The Advisory Committee on Immunization Practices is meeting tomorrow. They're holding an emergency meeting regarding these 6 cases. And so I think we'll have more information tomorrow as to what's going on. I think also now that information is available and this has been put out, we'll be looking to see if additional blood clot cases are reported after administration of the Johnson & Johnson vaccine. And then they need to determine if the vaccine was the cause or if there were other potential factors that could lead to the blood clots. And then they're going to likely have to weigh the severity of COVID-19 disease with having a vaccine that has a very rare, right now, one case in over 1 million people vaccinated adverse event. They're going to have to weigh that and decide whether or not the vaccine should continue to be used in the United States. Yep.
Just dovetailing off of that, given how rare these instances have been, you've talked before about the challenges that vaccine hesitancy poses to North Dakota's vaccine rollout. Do you have concerns that this pause may have been an overreaction at the federal level, or that it could potentially increase vaccine hesitancy unnecessarily in North Dakota?
Well, I'm hoping this pause in administering the Johnson & Johnson COVID vaccine gives the public more confidence in vaccine safety in the United States. It shows that the federal government is very transparent in putting out information when there are safety concerns about vaccines in the United States. It also shows that our vaccine safety surveillance system is able to rapidly identify very rare, and like you said, right now, it's one case per more than 1 million doses administered, very rare adverse events, and investigate them. And so if anything, I hope this provides the public with more confidence in our vaccine system, and especially more confidence in the 2 mRNA vaccines, the Pfizer and Moderna vaccines, where over 180 million doses have been administered and no serious safety concerns have been identified other than the anaphylaxis that was identified very early on, the severe allergic reactions, which are also extremely rare. Yep.
With Johnson & Johnson, you have Georgia, North Carolina, Iowa, and Colorado. In those states, they've had mass vaccine clinics where they've had to stop or pause those vaccine clinics because people are having more adverse reactions to the Johnson & Johnson vaccine than, Moderna or Pfizer. Is this a concern for you guys with the Johnson & Johnson other than just the blood clots?
Well, my understanding from other states who have paused administration of the J&J vaccine, a lot of those events appear to be related to anxiety over vaccination and not as much related to the actual vaccine itself causing an adverse event. And so we are concerned about the blood clots and the severity of these blood clots after the Johnson & Johnson vaccine. And I'm happy that the federal government put vaccination on pause to further investigate. But I guess we'll have to discuss as we have more information. If they resume vaccination with the Johnson & Johnson vaccine, we'll have to weigh the data and determine if as a state we want to continue offering Johnson & Johnson vaccine based on whatever information is available after the investigation. Yep.
Just, I guess, asking you to be a bit candid here. If you, obviously there's been a percentage of our population in North Dakota who have gotten the Johnson & Johnson vaccine. Maybe they just got it recently. What would you say, I guess, maybe to reassure or to give advice to the people who recently got the Johnson & Johnson vaccine in North Dakota?
Yeah, that's a good question. I think if someone received the Johnson & Johnson vaccine and it's been more than 3 weeks since they received the vaccine, I wouldn't be worried. This appears to be an event that occurs within a couple weeks after vaccination. And so if it's been more than 3 weeks, I wouldn't be concerned about having blood clots after the Johnson & Johnson vaccine. For other individuals who are more recently vaccinated in the past 3 weeks, we want them to watch out for symptoms like severe headache or leg pain or other signs of a potential blood clot and contact their healthcare provider immediately. We did put out a health alert today and advise providers as to how they should treat this situation because it should be treated differently than other blood clots. They're not supposed to be using heparin to treat this situation. And so when they do see people with suspected blood clots, we want them to ask about a previous history of Johnson & Johnson vaccine and then treat appropriately. And so, again, these are very rare, one case per more than 1 million doses administered. So I don't want people to panic too much because this is a very rare instance, but we still want them to be paying attention to signs and symptoms and calling their healthcare provider if they notice anything. Any other questions? Anything online? No? Go ahead.
A little unrelated to the Johnson & Johnson case specifically, but the latest data on the vaccine dashboard shows what looks like maybe the beginnings of a plateau, certainly a slowing down in the pace of North Dakota's vaccine rollout. Curious if you have any thoughts on why that might be occurring now.
Yeah, I think we have seen a slowdown in people coming in for COVID-19 vaccine. I think initially the people that we were vaccinating were the people that were really excited about COVID-19, that were seeking out vaccination, signing up on multiple waiting lists, looking for appointments. And so I think we've captured a lot of them. And now we're getting more to people. I don't even know if it's necessary hesitancy, where I do think we do have some hesitancy. I think there's some people that are more passive and will do it if vaccination is made more convenient to them. And so we're really working to make sure vaccination is available at convenient locations, at people's workplaces. We're piloting clinics at large department stores. And we're going to university campuses to offer vaccination. And so we're trying to make vaccine more convenient for people. And we're finding that if they don't have to set up an appointment and vaccine is right there and available, people are accepting the vaccine. And then I also think we do have some vaccine hesitancy that we're going to have to address. And it's going to take a lot more than, a mass media campaign. I think it's really going to take boots on the ground, doing education, people talking to their physicians and taking the advice of their physicians, and hopefully that will address their concerns about the vaccine and they'll be more accepting of it. Mm-hmm.
You mentioned that it would take more than a mass media campaign or something like that, or a PR campaign. What do you mean by boots on the ground? What sort of steps do you think could be taken to try to address what I'm getting at is that the recent data does seem to be almost like a flat line. Mm-hmm. And I'm curious if there's any sort of specific steps that you see the Department of Health or the state taking in the near future to try to address the hesitancy question specifically.
Yeah, the Department of Health did recently receive funding to increase COVID-19 vaccination rates, and we're planning to use those funding with many contractors, and so local public health, different associations, possibly universities, other organizations, community-based organizations, to really work with the people that they serve in educating about COVID-19 vaccine and the severity of disease, because I think there's a lack of understanding about how severe COVID-19 really is. And so that's our plan moving forward, is to really work with local agencies, trusted community leaders, and physicians to promote vaccination within their own communities. Any other questions? And Kirby Kruger is here. If anyone has questions on cases or variants, I can bring him up here as well. Oh, sorry, Kirby. Okay.
Thanks, Molly. Good afternoon.
Hi, Kirby. So I just have one question in regards to a variant update.
Okay.
Do we know how many cases of variants there are in the state this week, and especially, with cases rising? Is that a pattern that's occurring now?
So the question is how many variants, and just an update on variants in North Dakota. And this week, our lab did report out some additional variants, and we are now at 79 variants of concern that have been identified in North Dakota. Of those, 50 of them are the UK, or the B117 variant, and 28 are the California variants, and then we have one of the South African variant, the B1351. So again, the California variants are the B1427 and the B1429.
Are you finding?
Go ahead.
Are you finding these variants, through case investigation? Are these variants or these cases coming from out of state, or are they now being transmitted within state?
I think we have fairly good data. Even earlier on, we had fairly good data to show that there was transmission occurring within the state, where people who have been identified with variants had no travel history. And so I think that the data is showing that these are established in the state, except for the B1351, the South African variant. That one, we expected that was sort of an out of a case investigation where the individual had been in South Africa during their incubation period. So, and that is the predominant strain there. So we were expecting that one, but the others, I think, they're established in the state here. So.
Can I piggyback off?
Yes.
That? So, forgive me if this is redundant to what you just said, but given the data that you're seeing with the presence of some of the variants in the state, would you attribute that at all to the recent bump in cases that North Dakota has seen, or do you I guess you make a connection there?
I think that we're looking at the denominator data to see if we can determine what proportion of this may represent what proportion these variants may represent of the cases in North Dakota. But yeah, I think that it's part of what's driving it, because we do know that the UK variant is about 50% more infectious than the wild type virus. And we also know that the California variants are more infectious. They're each about 20% more infectious, according to CDC. And so they have an advantage over the older viruses that have been circulating in terms of their infectiousness. Yes.
How concerned is the health department knowing that they're more infectious, and do the vaccines protect against the variants all three in a different way, or just as effectively? That might be complex.
It is a little more complex. The vaccines, the question about vaccines and the variants is a good one. And I think the data that's emerging is that it's showing that the vaccines are effective to some degree in protecting against these diseases, and they can protect against disease, symptomatic disease, but I think what's emerging is that they're really good at protecting against serious disease, keeping people out of the hospital. And we also, I think the tool that we have in front of us that will help prevent the spread of variants is the vaccine, because if we can get people vaccinated so that they're less likely to be infected and less likely to transmit, I think that's really the key. And so vaccination is really an important part of what we're doing, what we want to do with trying to control variants in the state. Yes, Micaiah.
In regards to cases rising again, is this a concern for a possible second wave? At one point we did reach 10,000 positive cases at once, or current positive cases at once. Is this concerning, or is this just a pattern that we'll probably see from time to time of cases being over 1,000?
I think it's hard to predict what's going to happen with these waves. But I look at Minnesota and Michigan and what's happening in those two states, and it is concerning. And so I think that we can't rule out that another wave can occur and that the wave won't be serious. I think the good news, Molly pointed out that we are in the middle of this pandemic yet, and we are seeing cases increase in North Dakota. But I think the good news is that we do have vaccines that are available, and we have vaccines that are available. People who want to be vaccinated right now can get vaccinated right now. And so, I think that we still need to just really be diligent on that. And I think the other part of this is even with the variants, taking the time to do the things that are important to reduce the risk of spread. If the mask wearing and the social distancing, those things are still important. Staying out of large crowds and the hand hygiene, those things are still important in doing this. When I looked at the cases today, the number of cases reported today, there were 234 cases reported today. That's up 836% from the 25 that were reported just about a month ago on March 14th. Our trend is not the right way in North Dakota, and it may not be as severe as what's happening in Minnesota and Michigan, but it's still the wrong way. And I think it's just premature to think that this is over with in North Dakota. So, yeah.
Are there specific actions you guys are finding in the case investigation that could attribute to these cases, this rise in cases, or is there something, an area you guys are seeing there being a jump in cases?
I think that's a good question, and I don't know if there's specific actions. I think, when I visit with our case managers and our case investigators out in the field, and they talk about the things that they see, they're talking about people that are out in the community, and they're doing things that are in the community. We have cases that are related to schools, and we have cases where churches and other community events. So we have cases that are reporting attending a lot of different community events, and people are getting together. And we know that this virus is spread person to person. And so I think that the more people get together, the more we can expect that the virus to spread. The good news is that, again, going back to the vaccines, I can't emphasize it enough, is vaccines can really help with that. So. All right, so somebody's doing this back there, and I don't know what that means, but I guess we're going to call it. And I just appreciate all of you taking time to come during your busy day to come out and help us get the information out that we need to get out, and we really appreciate the efforts of the press in helping us to get information to the people. Thank you.